Hi, this is Dr. Robert Brueck coming to you once again with another segment of What's New in Cosmetic Surgery. Today we're going to talk about some new procedures, some new ideas, and I think it will help educate you on trends and what's happening down in the future. Also going to share some statistics from 2014 concerning some cosmetic procedures. One of the things I'd like to announce is the fact that Dry, which is that revolutionary new treatment for hyperhidrosis, has a new protocol. As you may remember, in the past it was a requirement to have 2 treatments separated by about 3 months. Now, after about 3 years of study, and this is FDA approved, they found that sometimes only 1 procedure is necessary, and the way we get away with 1 versus 2 is we increase the power setting on the apparatus itself. So now instead of having 2 treatments, you can have 1 treatment for way less than it costs for the 2 treatments together. So this is a new protocol. It's a wonderful revolutionary procedure. It's like electromagnetic microwave technology that destroys the sweat glands in the axillas and tremendously improves the amount of sweating that people incur. And it's really great. And in many cases, people have it done as an outpatient. We do it with little local. And in many cases, you can go to work the next day, or what we recommend sometimes is have the procedure done on Friday, and then you go back to work on Monday. So again, instead of 2 procedures, it's 1 procedure. So if you suffer from hyperhidrosis or excessive axillary sweating, this may be the procedure for you that may go ahead and take away some of the social embarrassment that you and others have that suffer from this condition. And it certainly is far less expensive than getting continual Botox injections into the axillas. Another thing I want to talk a little bit about, and I've touched about in the past, and that has to do with breast implants and the formation of what we call a biofilm. I recently met with some of the scientists at Mentor, and biofilm is certainly something that's been gaining a lot of press and publicity. Basically what it is, it's bacterial contamination of the outer shell of the breast implant, the silicone or saline implant. It's more common in textured implants versus smooth implant. And the bacteria populate the surface area of the implant, and they get that way because you go through the armpit, you go through the axilla, and you go through the periareolar or around the nipple complex. And of course there are bacteria on our skin all over, so we do everything we can to minimize that. We give intraoperative antibiotics. And, and what they found is that these bacteria populate the surface of the implant, and they produce a film, a glycoprotein film. And what they found is as the amount of bacterial contamination increases, the degree and severity of encapsulation increases as well. There was a study done recently that showed a 10-fold decrease in the formation of a hard capsule by simply going ahead and irrigating out the pocket with an antibacterial solution. Now, I tend to use a triple antibacterial solution. Another one that's commonly used is betadine. And by using this at the time prior to inserting the implant, they've been able to demonstrate a 10-fold decrease in bacterial population and a 10-fold decrease in the severity of encapsulation. So I now routinely use an inframammary incision for that reason of contamination. I use triple antibacterial or an betadine irrigation to wash out the pocket prior to the insertion of the implant. So these are some new and exciting things, because at the end of the day we want the implant to be nice and soft and natural. So that's our goal, and these are tools that we now have that can help us achieve that. One of the other things that I think is important is that more and more now, when we do an augmentation, it's not just doing a simple augmentation. You put an implant in and you close it up and you go home. What we want to do is develop a natural look. Part of that natural look has to do with the degree of soft tissue that covers the implant. In fact, just on Friday, I did an augmentation on a woman who lost over 100 pounds through a gastric stapling, but had lost a lot of soft tissue on the upper poles of her breast. So we did a silicone gel implant. I used a Mentor 375cc moderate profile. Then I harvested some fat from her abdomen and put about 75-80 cc's of fat along the superior aspect of her breast to give a more natural shape to her breast. And it certainly is something I'm recommending to patients more and more, because I think it really, really does make a significant difference. Along with fat grafting to the breast, we do a lot more fat grafting to the face, because part of the aging process is loss of volume and thinness or laxity in the skin. So in order to restore the volume, we do fat. There was a recent study done that had to do with the question, does adding platelet-rich plasma, or PRP, to the fat, does that enhance the overall effect of fat grafting? And there was a study done in which they took 60 individuals who suffered from facial atrophy. That is, they're people that have lost a lot of volume in their face as a result of a disease state. In most cases, AIDS is one that we commonly see, where people will have facial wasting. So what they did, they divided these 60 individuals into two groups. One group received just fat grafting alone and nothing else. The second group received fat grafting in addition to platelet-rich plasma. And at the end, and following up several months later, they were not able to tell the difference between the fat grafting alone and the fat grafting with PRP. So PRP itself may not enhance the overall survivability, if you will, of the fat graft. Again, it's important to remember, when we graft fat from one part of the body to another, it is a graft. And in order for that graft to survive, it has to establish a blood supply. And so that's important. So anything that we do to enhance that will only increase the effectiveness of that graft. One of the other things is there's a new product out for lip enhancement, and I may have mentioned it before, and I apologize for redundancy, but it's called Restylane Silk. It's a hyaluronic acid that is injected in the submucosa, that is below the pink of the lip, in order to enhance the lip. It also can be effective in treating the fine lines that people commonly get vertical to the vermilion border. It's a nice product. It's very soft, very malleable, and gives a nice natural look. So that's now available, and it's called Restylane Silk. And I think it's going to add a lot. Now, many times what I'll do is, when I'm doing facelifting on people or fat grafting, I'll utilize some fat. But sometimes people come in and all they want is little lip augmentation. So what I do to minimize the discomfort is I will go ahead and do a block to the lip, and that way it's numb, so you don't feel the pain, the torture of having fuller lips. And I know of some people that do this where they do it on themselves with no local, and unfortunately that's not me. I'm chicken. One of the other areas that I think I'm seeing more and more of, and that's gynecomastia, which is male breast tissue. There was a recent study done in which they looked at gynecomastia in male bodybuilders. Now, unfortunately, many of these individuals that are bodybuilders will take anabolic steroids. Testosterone is one that most people are commonly familiar with. So when people take these anabolic male enhancement steroids, many times they will develop unwanted breast tissue, and we call that gynecomastia. The vast majority of people that get gynecomastia, it's idiopathic. In other words, we don't know why it happened. It just happened. So I'm seeing an increased number of individuals for resection of gynecomastia. In fact, last year, in the 2014 statistics, there was a significant increase in the number of individuals undergoing male breast tissue reduction. It was like almost 26,000 people had this performed. So men, don't worry, you're not alone in that boat. There are a lot of people that have it, and I do a tremendous number of individuals. And when you evaluate somebody for male breast tissue, number one, you want to rule out any underlying cause. For example, it could be a medication they're taking or something along those lines. So if it is, you want to make sure that you eliminate that potential cause so that when you treat it, it doesn't come back. Now, what we do in male breast reduction surgery is to determine what is the gynecomastia. The male breast can be fatty tissue as well as male breast tissue, and I can determine that just by examining. So if you feel your breast tissue and it's kind of soft and malleable, generally speaking that's fatty tissue, and it may be amenable to simple liposuction. If the tissue is firm and gritty and it feels kind of nodular, that's more in keeping with male breast tissue, and in most cases that has to be surgically removed. The second aspect of gynecomastia surgery is what is the shape or condition of the skin. In other words, I see some male breast tissue reduction patients that have enormous breasts with tremendous laxity of skin. Unfortunately, in that situation, these individuals have to have a reduction in the skin envelope. In fact, I'll be doing a gentleman tomorrow who has large, sagging, pendulous breasts that are primarily breast tissue, and also a tremendous amount of loose skin. So we have to decrease, excise, shorten, lessen, whatever you want to call it, the skin envelope, which is involving a little more in the way of incisions. Because most of the time, if it's just a little nubbins of breast tissue, we can make a little circumarelar incision around the nipple. So we're seeing a large increase in the number of people undergoing breast reduction surgery. What's interesting in looking at the 2014 statistics, one procedure that actually saw a decline from the 2013 statistic was breast augmentation. There were 1% fewer breast augs done in 2014 compared to 2013. Another area that is showing a skyrocketing increase is buttock augmentation. I see a number of women that go to my website, Beauty by Brueck, and click on request for consultation, and they go liposuction / buttock augmentation. Now, I don't do buttock implants. Some people do. I don't. But I can take fat from one part of the body and use it to augment the buttock area. And this is a way to rob Peter to pay Paul. There was a recent article in the White Journal that chronicled 9 cases of simultaneous tummy tuck gluteal augmentation. Now, most of you are probably familiar with an abdominoplasty or tummy tuck, where we make an incision all the way across the lower abdomen, we undermine up to the rib cage, and we cut out a huge segment of skin and fat. Well, what these doctors did was they took that excess skin and fat, they took off the outer layer of skin, they put it on a towel in antibacterial solution, warm, and then flipped the patient on their stomach and made an incision about 5 centimeters medial over the buttock area and developed a pocket over the buttock. And then they took these pieces of tissue of dermis and fat that would normally be thrown away with a tummy tuck, and they actually augmented the buttock. So people were able to get what I call a two-for one. In other words, you got a tummy tuck, so you got a flatter, firmer abdomen, and you got more definition and fullness to your buttock area. So buttock augmentation, whether it's with something like using tissue from a tummy tuck, or whether it's with autologous fat, is certainly a procedure that's on the rise. And I think last year in 2014, over 11,000 women underwent buttock augmentation. And of course, by far, the number one cosmetic procedure